Thank you for joining us. My name is Donna Ibe. I'm the Academic and Creative Director of the Future Work Skills Academy, and we are here today undertaking yet another of our interviews in our Human Ingenuity competition. We are absolutely stoked, using an Australian term, to have Dr. Alicia Liu and Dan Wu with us today from New York. And of course, we're joined by my erstwhile fellow interviewer, Ellen Drester, in Boston. The Human Ingenuity competition is designed to amplify the voices, the actions of people, individuals and organisations around the world who have demonstrated novel thinking, which we'll unpack a little in this interview and all our interviews, in face of the pandemic that the world is addressing at the moment. So I'm now going to hand over to Ellen to introduce herself, and then to Alicia and Dan to take us through their story. Thank you, Ellen.
So I'm Ellen Drester. I'm the Managing Director of Pearl Partners, and we are a consulting firm that works with medium and large organizations with senior leaders who lead those organizations. And we work with them to be able to continually adapt to lead their markets through this constant change that we are seeing more and more of these days, but to do it in a way that they continually align with their strategic goals, so that they do have consistency in who they are and their purpose in the market.
Thank you both for having us. This is a really amazing opportunity to get to know both of you, and yeah, we'd love to share our story. I'm Alicia. I am an emergency medicine resident physician in New York City, and this is my partner, Dan. He and I started Frontline Suits, which is a nonprofit donation initiative to donate washable coveralls to thousands of healthcare workers, particularly on the front line. And this initiative started during the pandemic in response to a desire and a need to better protect healthcare workers from contact transmission, in addition to the protective equipment that we are already given. Dan, do you want to introduce yourself?
Yeah, so I'm Dan Wu. Again, thank you so much for having us. Really excited to be here. I'm privacy counsel and legal engineer at Amuda, which is an automated data governance platform for analytics. So I'm really interested in sort of data protection and data strategy, but also thinking about how we can incorporate these things into product and software so that organizations can do the right thing by default. More generally, I did my PhD at the Kennedy School in sociology, really focused on urban policy, and law degree focused on technology and data. So really excited to be here and to share more about Frontline Suits.
That is fantastic. So thank you very much, both of you, for your introduction. So this story and the nomination is around the suits. And so we've got a series of questions that we're going to ask you. And the first of those questions is that both of you have quite distinguished careers, and problem solving and creativity is part of both those of your lives' journeys. Both separately and I'm sure together as example with this initiative. So if you could just, for example, highlight, and I know it's a big thing that you've done, but if you could just take us down to some key aspects of how you actually determined this idea against the problem. So explain a little bit about the problem, and then how did you decide that this was the solution for that problem?
Yeah, so I'll start. And this whole project started with my experience working in the emergency room and the medical ICU. Normally I'm in the emergency room in this during this month of March when COVID really hit New York City very hard. I also was working in the ICU. And so I basically have seen the progression of COVID in New York City from the beginning until now. And this project is particularly focused on the protection of healthcare workers. So the standard for PPE or personal protective equipment is a mask, ideally a N95 mask, some kind of eye protection, whether it's goggles or a face shield, and an isolation gown, which comes up to here. It covers the front of our bodies, our arms, and it covers only a little bit of our back. And so with this, you know, initially we were provided this, and when I was working in the ICU, there were definitely many instances where I started to question if this was enough, especially in trying to learn from the lessons of other countries that had experienced COVID before us. So in particular, one experience stood out in my mind where I was the only doctor on an overnight shift in the ICU, and I was the team leader for running a resuscitation of a patient who lost their pulse. So their heart stopped beating. We call that a code or a cardiac arrest. And this is something that happens all the time in the ER, ICU, and other parts of the hospital. And all the medical providers are trained to respond to this. And so we, without really thinking, we just kind of jump into it and respond right away, trying to resuscitate this patient and save his life. And this time, I happen to be leading the resuscitation, and not only do I have to think about all of the coordination efforts of what people should be doing to save the patient, but on the forefront of my mind was how can I keep the entire team protected, especially when COVID was just starting to ramp up in March. And I had this like bird's eye view of what people were exposed to, the procedures they were doing. They were very high risk. And at the end of it, it still bothered me that there were definitely parts of our bodies exposed, our necks, the back, our clothing, even when we were wearing everything that we were supposed to wear. So that, you know, got me thinking, and I was talking to Dan about my concerns, and we brainstormed together and realized that we'd love to find a way to provide frontline workers with head-to-toe protection in a way that was feasible and something we could do kind of immediately, because COVID cases were just rapidly increasing and overwhelming healthcare systems. So that's how this project started.
That is fantastic. And Alicia, what came out of this was the suit. And tell us about that suit, what it looks like, and then some of the decisions you made in how it's actually produced, what it looks like, because you say things about the back and your neck being uncovered. So obviously you've got some design imperatives around that, the construction of that. How did you go through that process? Was that experience? Did you talk to other people? Did you brainstorm amongst just yourselves?
All of the above. So it started with at the same time that I had these concerns, but didn't really know what to do with them. There was a petition that got over 2 million signatures that was started by doctors in San Diego that petition for an increased standard of protective equipment for frontline workers. And in that, there's a photo showing what healthcare workers in Italy and China were wearing compared to what we were wearing in the US. It had that classic picture of essentially what looks like a hazmat suit. I'm sure you're familiar. It just like looks really intense. The person is covered head to toe. And I looked closely at this and realized that the only real difference between what we were wearing and what they were wearing was this coverall. That other people call it a Tyvek suit or a moon suit or a bunny suit. And so I thought that was interesting because it looked like a lot higher protection, but it really didn't seem to require that much more. So at the same time, I talked to Dan about this and was like, I wonder how we can get this because no one was wearing it. Dan helped me to help research to see if there was actually any evidence behind this. Does it actually protect you or does it increase the risk of infection? And he found some a preliminary study from Harvard that looked at all the different types of public health measures they were taking in Wuhan, and what ultimately led to a drastic decrease in the healthcare worker infections. And one of the key components was this head-to-toe coverage. So that was actually really interesting to me, because around that time we had a series of donations, masks, but also these disposable coveralls, and essentially what they were wearing in other countries. So I tried it on, and I wore it to the emergency room where none of my coworkers were wearing it. This was a donation in the ICU. And I got so much attention. A lot of my coworkers came up to me and said, "Where'd you get this? Where can I get one?" So that was kind of the, it started with the idea, but then I started to get a little bit of initial feedback that maybe this is something that other people want as well, particularly for this reason, because we all have this instinct that, there is already evidence that COVID is transmitted by respiratory, but also by contact. So once I got this initial feedback, I realized, like, hey, maybe we should be wearing coveralls too. But then the next problem came up, which is that we actually got these donations to the ICU, and after 2 days they were gone, because all of them were meant for one-time use. So you wear it and then you just dispose of it. If you try to wash it, either, there's not a really good way to do it, it may not be safe. So that was the next problem that came up. And so in this process of brainstorming, we realized, like, what if we could have a reusable coverall? And then that's how we decided to try to make it a regular practice, or at least an option that was available to those who wanted it. So in order to do that, we thought maybe it needs kind of a critical mass of providers who want to wear it and can kind of normalize it at work, and feel comfortable wearing something like that when nobody else had been doing it. And to do this all really quickly, because there was a real threat and a real risk of getting COVID on your neck or your clothing, and maybe taking it home with you and going on the subways or going into Ubers and going into your own home. And people were concerned about spreading COVID to their kids, their family members. So yeah, that's how we decided to fundraise money to try to buy an initial round of reusable coveralls. And so at the same time, we wanted to do this safely. We also didn't want people to replace their PPE with something that is not really scientific. It's just kind of trying a new thing. So we instructed everybody that they still need to wear the gown over their coveralls. So essentially what we were donating would turn into kind of an extension of their clothing, as opposed to something that kind of overrides what was the standard practice. So we only wanted to increase the protection rather than take away from it. And we got a lot of support. And as we started to distribute donations, people gave more and more positive feedback. They were very grateful for it. And it just allowed us to kind of gave us the fuel to continue advocating for this and try to raise awareness that maybe this is a feasible, cost-effective idea that would help to kind of decrease the anxiety about transmitting COVID or having an increased risk of COVID as a healthcare worker.
I'm going to add two really quick points to that. I thought that was really, really good. Additional 2 points are just in terms of thinking about landing on the washable suit. We were also dealing with various parameters, I guess, or limitations. And Alicia alluded to this with the reusability. At that time, and I think definitely to some degree it's still happening, is this idea of pandemic era supply shortages. This recognition that all of our supply chains were basically getting destroyed. And during this time of crisis, our usual supplies of things like masks and other things that we would take for granted kind of evaporated. And so with that condition, we were also balancing the feasibility of, okay, if we wanted to do suits, how feasible is it for us to even rely on future supply chains that would allow us to keep purchasing and shipping more suits? We didn't want to rely on that, which we realized was an assumption that basically what was happening to the mask supplies at the time. We didn't want to fall into the same mistakes. And we had also read this really interesting perspective by, I'm blanking on his name, but he's this really famous surgeon. Dr. Atul Gawande, who was talking about his experiences in East Asia and also noting the importance of these reusable suits, but saying that, hey, unlikely to be very feasible in the States because like who would buy them? How would you get them here? The supply chains that are necessary. And so that added more and more understanding like, hey, actually this limitation of supply chains and this limitation of can we expect to get future product out there, that became a really important way to design them. Like we prioritize the importance of reusability as a key condition that informed our design. And the second thing really quickly is this idea of like, what would be a unique contribution? That wasn't something we were trying to like, optimize for necessarily, but we also wanted to build off what was already happening. We noticed, for instance, that there were lots of donations, fundraisers for things like, hey, donate so that, we can purchase a bunch of masks from China and donate them to healthcare workers. We noticed that in sort of like the first couple of weeks that a ton of these were going up. And we realized like, let's not be competitive with what they're doing. Like, we shouldn't yet set up another fundraiser around mask donations and then give them out. Like, how can we actually create a contribution that draws from Alicia's day-to-day experience, but also from, this limitation that we're seeing, you're gonna buy these masks and they're gonna have to get thrown away after a couple of times, like learning from that limitation. And third, the sort of formative, like emerging evidence and data that the head-to-toe coverage is really critical. So that all of these things sort of like helped us land on this idea of a washable suit.
So I'm really curious if you could talk about, like you've alluded to learning from others' mistakes and, making your choices as you went along. Can you talk a little bit about how you experimented? I mean, it seems hard to believe that you would have just said, Eureka, this is it, right? You probably had to do a little bit of iteration and trial and error there. So I'd love if you could talk a little bit about that.
Yeah, so and I also want to make sure that I answer the previous question, which I forgot to do, about the design elements of the suit, but it was all part of the process for sure. So every step of the way, we didn't anticipate this to kind of grow into what it did. And really it was because every step of the way we wanted to make sure that what we were doing actually had a positive impact and made sense, and certainly didn't cause any harm to anybody. So it just happened to be that every time we tried to get feedback on what we were doing, it really just was very positive, and it also grew into more ideas, how to make this better, how to make it something that people could benefit from. So initially we kind of gathered informal feedback. It helped a lot that I myself was just looking for something that I would be able to use at work. And also I was just surrounded in a work setting where I could just quickly ask my coworkers if that's something they were interested in. And then we also decided that we didn't want to assume that this is something people wanted. So we sent out a survey for people to request, and we didn't label it as a survey. We just said, hey, request a free reusable suit here. And it just happened to have a couple survey questions. And that way, every single suit we donated went towards somebody who wanted it. And that helped us to first hear kind of how they felt about their current protection, and also if they thought that this would be something that would benefit them. And we also left an open-ended question about their feelings, and it turned out that a lot of people did not feel safe, especially during the peak of COVID. So that kind of further drove us to realize the importance and the purpose of what we were doing. And then once we were able to distribute washable coveralls to them, we gathered a lot of feedback, and both through word of mouth and also through more surveys. And it just turned out that that's something that they really wanted. And I had people coming up to me at work asking me, you know, where they could get one. Someone took theirs. And so we realized there was really high demand for them. And we were able to, you know, we didn't want to just stop at my hospital where I worked, because we realized there were a lot of hospitals and frontline workers that were suffering from the same thing. So I contacted friends in medicine at other hospitals and asked them if they were interested in helping to be a point of contact where they could go and spread the word to their coworkers and then receive the donations and help distribute them. So we were able to reach 9 hospitals during the most intense part of COVID, which was awesome. And yeah, so as we did that, it wasn't the perfect solution for sure. This was not standard practice. So we found when we searched online for reusable coveralls, there are really not a lot of there were really no like commercial reusable washable coveralls that you could just buy that were designed for healthcare workers. So the ones we started with were adapted from other industries like auto workers and painters. Sometimes like there are these lab cleaning rooms that use them. And so initially, out of an urgency, we used the fundraise money to purchase whatever we could find that may have been, you know, adapted elsewhere. And like I said, we made sure that people would wear the proper PPE over it so that, you know, we didn't try to make it sound like it was going to protect them 100%. We let everybody know this is not medical grade. You need to wear it with all the standard protocol. And so as we did that, we realized that they have different design features. We were able to sample like all these different types, and people gave feedback on them. And eventually what happened was that we realized that there was a supply problem, that, you know, this is not sustainable if we just continue doing this donation project. So we actually, Frontline Suits was inspired a new startup that would design, you know, a reusable washable coverall for specifically healthcare workers. And so I'm advising that project, and it's called Recoveralls, and that one's totally separate, but it was definitely inspired by our experience. And so I helped to inform the design of the prototype and based on our experiences. And I'll tell you a little bit about some of the things we thought about. So those coveralls are made with medical grade barrier fabric. So the actual fabric is more protective than what we had initially adapted from. And, you know, we gathered some feedback from healthcare workers from our experiences to help figure out, you know, how many pockets and where it would cover. Like there was a study that came out later that in Israel, they simulated an intubation using fluorescent markers that would mimic secretions. And intubation is the highest risk procedure for getting COVID. And so what they found, that even though the provider was wearing all the standard PPE, they still were able to visualize that there were lots of secretions still on the provider's neck and their ears, and places that weren't covered. And so, you know, it was really important to make sure that these suits had covered their necks and places that they don't necessarily need in the other industries. So yeah, that's to speak to the design features. It was definitely a process of learning based on what we did immediately. And now for the suits designed for healthcare workers, the first 1,300 they're being made at cost, and they're going to be donated pretty soon, actually. I think by the end of this week they'll ship out. Yeah, and we hope to donate them to the places of highest need. So we've reached out to people who work on Navajo reservations and nursing homes, psychiatry units, places that are definitely less resourced than where you would traditionally think of as a traditional hospital setting. So yeah, that's kind of, we have had multiple steps throughout the process and have gotten feedback to try to improve it. And yeah, we hope to continue improving it and also advocating so that more people can benefit from this idea.
Just if I could build on that really quickly, I think that was a really good description of what happened. And I think another thing to add, I think there's two things to add. I don't think this project could have worked without Alicia being there on the front lines and being there on the ground, because so much of this had to do with relationship building and really understanding the lived experiences of people on the ground, and also understanding that in the healthcare field, emergency room, there are people with different levels of legitimacy and credibility, essentially gatekeepers where you have to get their support. So Alicia is a resident. She is a doctor, but she's a resident, kind of like lower on the totem pole. There are attendings who are like, you know, supervising doctors who've been further along in their practice, and there are like senior attendings who have a lot of, they're like more well-known in their fields, have been practicing, and then there are like program administrators who essentially are overseeing. And so, and then of course as well, like nurses and medics and technicians and things like that. And I think Alicia essentially, in my belief, was a community organizer of sorts. She was so embedded in this context, knew exactly what these different actors cared about, and was able to start predicting some of the concerns. So for instance, this idea that we were really phrasing this as supplementing what already existed instead of replacing, because through her initial conversation, she had already known that that was going to be a key concern. And that was in fact one of her concerns, is that we didn't want to create more harm. And I had also had some very preliminary conversations with people who had done like regulatory work in the field. And those are some of the conclusions that we came to as well. And so I think that was really critical, was that she was embedded in that lived experience, knew about the different types of actors in the healthcare field, which, you know, can be very slow moving and it could be very bureaucratic. And I think the second aspect is that I think we experimented with different levels of fidelity over time. I think you'll note that our final conclusion was the medical grade sort of perfect reusable coverall. But that came as sort of as a conclusion over 2-3 months. I would say our initial experiment was simply conversation, the conversations that she had with her attendings and program admin, just asking them, what do you think of this idea? Like, how do you feel? And then making that conversation more systematic and formal through the surveys, and literally asking people, would you wear this? Like, would you want your program to purchase this for you? And embedded in that survey was again, relationship building, seeing who was actually on our side, asking if this was being sent to an attending, again, like one of the senior supervising doctors, asking if they would be on our advisory board, and then starting to get advice from them around, this is what you think. Part of our process was also asking if people would be willing to publicly state their support for a suit. Understanding that, you know, politics is a huge part of this. And then we went to the medium fidelity of getting suits from other industries, having Alicia, actually before that was simply just even wearing the disposable suit that she was talking about, which already was donated, and seeing how people reacted, because that wasn't standard practice at the time. Then the suit from other industries that we could immediately buy, and doing specific conversations with people around their experiences wearing the suit and what they would like change. And then finally was sort of the most like I think in some ways more fidelity or higher accuracy around the medical grade fabric and the suit that's specifically developed for medical professionals. It was out of the culmination of lots of different sort of intermediary steps. That wasn't the perfect solution in the beginning.
That's very, very interesting, Dan. I think the idea of iteration is principle in design thinking. so that you would prototype and you'd iterate. But if we look at some of the interviews that we've had in the case studies we're looking at for this, for the Ingenuity competition, there's various levels of risk associated with the problem that people are trying to solve. So if we look at one end, we have Maddie Gersh. She has the hair salon, so self-service salon, and she has moved. So her story was that she came up with videos on how to cut your hair very simply, and she created these home colour kits, which she experimented with. And she used to sit in a park, and people would come up and they'd have the brown paper bag and they'd swap it. She was like a local drug dealer, except for it was hair colour. Now she's moved that to home, but where are people washing their hair? At the tap at the back of her house in Boston. Now, that is a very rudimentary but real response to that situation, because you had to turn her home into a salon, or where do you wash your hair? And you've got to think about contamination and, et cetera, et cetera. So she's thinking about those things, and you're outside then. You can wash your hair outside, and you get your hair cut on an open, what we would call a balcony or a veranda. Now, so the idea of fidelity when it comes to human lives is a lot more of a serious kind of consideration here. And so in the middle of that, we have the Colombians who are getting medical, have worked with Harvard medical students to get medical information to places in Colombia that get water once a week, have intermittent electricity and no internet. How do they learn about the dangers of COVID and how to protect themselves? So the labels that they've put on fast-moving consumer goods, they're serious. Their issue of fidelity was about making sure that the medical information was correct that was being communicated with them. So every novelty, every problem has a various level of risk associated with it. So it was very interesting to me when we looked at the idea of fidelity that you actually added onto what was already there. I mean, that's a risk mitigation factor in itself, right? So you had your PPE and that, not that instead of. And so I think that is a very, very interesting perspective for people to understand that iteration is not just about the comfort of your co-workers. It's not just about the networks, the system that you have to deal with in order to sell and have your idea taken on board and the comfort of people, but you've also got to be considering the idea of risk. And it's a very serious situation. But what is interesting of all that for me as well is that regardless of having a slow-moving system, you still got it done. And you use that process to get it done, understanding, as you say, it can be slow-moving and bureaucratic. So I think it's a great example to people that you can get things through, but you have to think about the system, you have to think about the politics, you have to think about campaigning, and you have to think about fidelity as you iterate that takes into consideration the greatest risks of that problem. Would you add to that, or like to comment on that?
I totally agree. It's something that we learned through this process, and also kind of was already in the back of our minds that we're dealing with people's lives here. So we definitely didn't want to do any harm. We didn't want to assume that, our idea was going to be just fine for others. And it's helped that there's been more evidence now that's come up, but in the beginning, when you have something new, a new idea, there is not a lot of evidence on it. And at the same time, based on common sense, based on what we had already learned about how the contact transmission of COVID, we just had to use the resources and data that was available to us to decide what we are kind of our best educated guess of what would help people during an emergent situation where everything was new. Nobody had been through this before. So I think just we didn't realize that it was about risk mitigation, but essentially not wanting to cause any harm was really high on our minds. And I think part of this came from when I some anecdotal discussions with other healthcare workers about why we don't wear those full hazmat suits in other countries. We actually had reached out to a friend of a friend of a friend who was a nurse in Wuhan, China, who we kind of got in touch with and asked them, like, what were they wearing? How did they use it? And we learned that there were a lot of downsides to wearing those coveralls. It's really hot. So like healthcare workers would, you know, there's a risk that because of that, they might just unzip it and then defeat the purpose of it. Or like the fact that, you know, if you are not, most people at that time were not wearing a disposable gown over it or any type of gown over their suit. So it was just the bunny suit. And criticism I had heard about that would be that it might protect the provider, but does it increase the transmission between patients? Because now you're not able to change your suit every time you see a new patient. And so all these factors went into trying to be thoughtful about what we were doing. And that's why, you know, we were really careful to instruct everyone to wear the gown over it. I reinforced it over and over and again at work, but also for the people I don't work with, that's another reason why we felt that everyone really needed to fill out that request form, not just to show that they wanted it, but also because that's the place where we were able to communicate with everyone. How do you use it? How do you wash it? How do you wear it? So all these steps were, you know, it doesn't take much time to think about these considerations. It really was just adding another, you know, sentence or two onto our request form. But I think that if you stay focused on the impact that you're having and realize that you may be well-intentioned, but you might cause inadvertently have a negative impact, I think helps to allow you to consider these factors and account for them.
Yeah, just to build on that, I think that's both of those are fantastic points, Donna, your point about fidelity and risk and all these points that you had made, also about like ways to think about how we can mitigate risks. I think another thing that I think like was actually ended up being really interesting is sort of like my legal background, where I am really anxious. Like I get really worried about things, and I was thinking a lot about what are the worst things that could happen with this project. And additionally, having connections to people who were sort of in the legal and regulatory field. And so it was really actually helpful for us to think about, starting to think about what were some of the main risks that were existential risks of the project, like ways that people could use the suit in the wrong ways, or ways that people sort of in leadership, policy leadership, could view this in wrong ways. And then also thinking really systematically around, I remember at one point, we were talking about like the different sort of ways that we were trying to reduce risk. For instance, you know, this whole point about one of the big reasons we had the survey was this idea of educating, but also because it's really important for us to be transparent and tell them, you recognize that this is not PPE as traditionally defined. That you recognize that, you know, this isn't a perfect, you recognize that you're going to supplement this. That was really, really important for us to be crystal clear about that, and that we had a form which we said that, you know, you agree with this. And so a lot of those sort of tools around being really disclosing, obviously, and as much as possible in clear, plain terms, like these were the potential things and limitations, and making sure that people understood that was really critical. And then secondly, being able to be connected with folks who were kind of either on sort of the regulatory side, like maybe they had experience working in a federal agency around this, or friends who had worked in law firms, potentially thinking about product liability. It was awesome to be able to phone those friends and ask them, like, what do you think about this project? Let's talk through the risks versus benefits together. And I think a lot of that helped us feel more comfortable about what we were doing, to make sure that, hey, like, sanity check us. Like, you would be potentially working on a case litigating against someone who does product liability. Like, how would you think about this? And so a lot of those like legal policy conversations ended up being really helpful and helped us be a bit more thoughtful about the experiments that we were taking.
It was really striking to me how it would have been so easy for you to just say, Alicia, you're on the front line. We're designing for you, right? Or you're designing for yourself. And you see this all the time, especially a lot of entrepreneurs. They just design for themselves and they don't get any feedback from anyone else. And you're in a situation where it would have been very, very easy to do that. And yet I found it really striking, and I really like the way you described that, you know, and Dan, when you said she was more like a community organizer. And so that is the antithesis of designing for yourself, right? You're really bringing, you know, as many as you can to the problem and to think about it. So, and then you hear all these best practices in like design and corporate change, and it's like, oh, you have to get outside of your walls and all these things. So can you talk a little bit about, like, you know, it seems intimidating on the one hand, yet on the other hand, it could be seen as easy because it was you that knew what you needed. But then what was going through your mind, and words of wisdom for people who say, yeah, we've got to go outside, but we really do know what we're doing. And then what was going through your mind, and what words of wisdom would you offer around that?
Well, that was absolutely amazing, and as fantastic as I knew it would be. You two are both of you are awesome, and a powerful team. Just shows about the whole thing, as no one does any of this on their own. You know, when you look back at the history about, you know, the light bulb and all the inventions, and you unpack it, it was never just one person. It's always a team, and it's a village, and, you know, and it's purpose driven and driven by the heart. It's often driven by love. When you unpack it, it's there. So I can't thank you both so much for taking the time out of what is still a hectic schedule. We'll be providing information for everybody on both these two and the different projects that they're involved in, including Recoveralls. And I'd like to also thank Ellen for her always thoughtful questions, and for being part of this project. Thank you very much, Ellen. I always appreciate your company on these. It's so good. It's so great. So for everybody, that is the wrap up for this particular interview. And you can, if you know anyone or an organisation who have shown ingenuity during the pandemic, as we say, which has continued, we were all hoping it would be short, but it looks like it's going to go on a little bit longer. If you know anyone, an organisation or an individual who's shown ingenuity in the pandemic, please contact us on our website, and there's a little bar at the top, and you can submit a very quick submission to put those people forward as a nominee in our Human Ingenuity competition. And also you can look at our page on LinkedIn, where we're displaying these in videos in our vodcasts, so you can see those then. So thank you very much to both of you, and to Alan, and to everybody, and we look forward to seeing you all in our next interview. And for you two, we look forward to seeing what comes next.